Radiology and Global Health, presented by Mariah Jacobson Lopez. Global health is a collaboration between all sectors to achieve health equity throughout the world. The founding principles are similar to the Alma Ata Declaration of 1978, that health for all is a human right, the current inequality of health is unacceptable, and that achieving global health requires collaboration between all sectors and nations. An aspect of global health is reflected by the global burden of disease, GBD, which can be assessed by a collection of data figures gathered by the World Health Organization called Global Health Estimates. The estimates show health trends, disease profiles, and give insight to potential interventions. Global health estimates from 2015 show trends for the 2000 to 2015 time period. During this time, there was an increase in deaths from non-communicable diseases, where ischemic heart disease and stroke became the leading causes of death globally, and there was a decrease in global deaths from communicable diseases. These trends suggest an overall decrease in health inequality. However, regional differences in the global burden of disease correlates with the country's resource level, where low to middle income countries have a disproportionate number of the maternal, perinatal, infectious, and nutritional deaths. Related to this correlation are the risk factors for severe disease, which are poverty, poor living conditions, malnutrition, and HIV infection and exposure. As a response to global health inequality, the Sustainable Development Goals were created. These are 17 goals addressing economic, social, and environmental aspects of sustainable development intended to be achieved by the year 2030. Health is addressed in Sustainable Development Goal 3 with 13 targets to achieve the goal. These targets prioritize the needs of the poor and vulnerable and follow the ideal that eliminating poverty is the key to achieving global health as well as the biggest challenge. The 17 Sustainable Development Goals are shown in Table 14.1 on the left. Table 14.2 on the right shows the health target subpoints of Goal 3. Global radiology is a relatively new subspecialty of global health that is also focused on achieving health for all and currently is an international community working to provide equitable access to radiologic services globally. These services are necessary in building effective healthcare systems and preventing diseases. To exemplify this, radiology can help achieve 6 of the health targets for Sustainable Development Goal 3, and according to WHO, diagnostic imaging is one of the necessary building blocks for a healthcare system. However, approximately half the world's population has no access to even basic imaging being X-rays and ultrasound. Targets 3.8 and 3C assist in the expansion of radiology services. As you can see, there is quite a bit of codependency between these issues. Now we are going to look at some specific ways basic imaging can help achieve the health targets. The majority of deaths related to maternity occur in low to middle income countries and are preventable. The primary causes are listed here. Ultrasound can reduce maternal mortality by providing care planning, such as after-delivery care, which can prevent puerperal sepsis and identification of predisposing factors to hemorrhage. It can also provide insight to high-risk pregnancies where additional resources may be needed. Preventing perinatal and child mortality pertains to Sustainable Development Goal 3.2. Primary perimortality concerns are birth asphyxia, birth trauma, and premature birth. Incidences of these are especially high in low to middle income countries. Ultrasound allows delivery planning by providing an expected delivery date, which is extremely helpful for expecting mothers who need to travel far for delivery. It also allows monitoring of fetal health, and if any problems are detected, the family can be referred to needed resources. Delivery can be monitored to provide early intervention in case of complications. X-rays can identify and assess pathologies associated with premature birth, such as necrotizing enterocolitis or surfactant deficiency complications. The leading cause of mortality for children under 5 is pneumonia. Chest X-rays are able to confirm diagnosis as clinical findings are not always accurate, as well as evaluate the lung pathology by providing information such as the severity, location, or if an HIV infection is also involved. Ultrasound confirms pleural fluid presence, the nature of the fluid, and can assist in guiding the aspiration of the fluid. Tuberculosis is one of the top 10 causes of global death and is addressed by Sustainable Development Goal 3.3. 60% of new cases occur within 6 countries, and the plan to achieve this health target includes increasing immunization programs in areas that are high risk, but also depends on early identification, which can be achieved through the use of chest x-rays for screening. Signs of active infection will be visible on a chest x-ray, as will signs of previous infection. Previously affected individuals can be monitored with imaging for recurrence of infection, which provides identification so those individuals can get treatment and prevent further spread. Between 2000 and 2015, non-communicable diseases increased by 26%, the majority of which were from cardiovascular disease or malignancies. With cardiovascular disease, chest x-rays are able to be evaluated to see if chest pain is related to the heart by assessing heart size and if other signs of cardiac failure are present. Echocardiography provides detailed images of the heart, allowing visualization of chamber sizes and valves. Both help identify congestive heart failure and help monitor responses to treatment. For malignancies, lung and breast cancer are 2 leading causes of malignancy-related mortality. Chest x-rays often provide the first evidence of lung cancer. Given that early signs and symptoms are nonspecific, chest x-rays are essential for confirmation. Screening for breast cancer has been shown to lower mortality rates, and film screen mammography is able to detect calcifications typical of breast cancer. It is relatively affordable and available, but does have its limitations finding smaller lesions, particularly in dense tissue. Technological advances in ultrasonography are increasing its use as a screening method. Sustainable Development Goal 3.6 aims to halve the number of global deaths and injuries from road traffic accidents. The best thing, of course, is preventing these accidents from occurring. However, when they do occur, diagnostic imaging is needed for diagnosing and managing injuries. X-rays are good for identifying and managing serious traumas, such as perforated bowels or an unstable C-spine injury, as well as providing baseline and follow-up images or evaluating non-emergency thorax injuries. Ultrasound helps assess trauma patients for triage, providing information about serious conditions like a pericardial effusion. We just reviewed the ways in which basic diagnostic imaging can help achieve a number of health targets, but there are challenges preventing equitable provision of those resources. The biggest challenge being unequal access to services, which is a multifaceted issue involving geographic or logistic barriers, economic factors, differences between private and public healthcare, and access to skilled workers, to name a few. Interestingly, development and technological advances in imaging have widened the inequality gap. These advances have changed and improved imaging, but they've also increased the demand for skilled labor as the field becomes more specialized, and created a broader spectrum of resources, with high-income countries at one end with access to the latest advancement, and low to middle income countries at the other end, in some cases without access to any imaging resources. In conclusion, we see that global radiology and global health are codependent. Diagnostic imaging is a necessary part of achieving global health and can contribute to multiple health issues, but it faces the challenge of unequal access to services. To overcome this inequality, other aspects of global health must be achieved. For example, Sustainable Development Goal 3C focuses on developing the healthcare workforce in low to middle income countries, which would help improve access to radiologic services. Also, as technology advances, responsible, sustainable use of radiologic services, particularly in high-resource countries, is necessary to further bridge the resource gap. Alright, that's it. I hope you guys enjoyed watching this presentation on radiology and global health.